to present clinical experience we performed in Padua with an exercise protocol developed by Professor Carraro and his research team that is about treating patients with old age at home and in particular in bed, thanks to this particular protocol, the so-called home-based full-body in-bed gym protocol. And so I will treat the basics, the implementation and application during time, and our preliminary results taken from the clinical experience. So, as already as said all the previous speakers today, exercise is able to revert and prevent muscle changes through mitochondrial changes, greater capacity to produce antioxidant enzymes and energy, and through the prevention of the expression of the proteolytic pathways, for example, caspase, catepsin, and the ubiquitin pathways. First, home-based rehabilitation experience have already demonstrated that both for patients with musculoskeletal and neurological impairments, this type of intervention can be able to revert and to ameliorate function, for example, mobility in neurological patients and also well-being and overall quality of life. But also at-home protocols have demonstrated to be comparable to inpatient traditional interventions. For example, in patients with outcomes after surgery of hip fracture. And moreover, for these patients, a positive effect is linked to the better family support they have at home in their comfort zone. Since we know resistance exercise and maximal voluntary contraction performed both isometrically and dynamically, so with joint movement or without joint movement, are able and feasible during immobilization and bed-ridden periods, the proposal of Professor Carraro, formulated in 2014, was to develop a program to be performed whole in bed, also for patients with mobility impairments. So really briefly, the home-based full-body in-bed gym protocols is composed by 10 exercises that can be repeated daily for a daily routine lasting from 10 to 30 minutes every day. And these protocols includes exercise for the cardiovascular and respiratory function and also exercises to strengthen muscles. Support the exercise performance, educational brochure and exercise videos were conveyed to patients in order to allow to patients to perform the appropriate technique of exercise. And in addition, clinical follow-ups were included in the exercise protocols, so the doctors and the therapists can follow the progression in exercise performance and also in changes in motor function. The exercise protocol is really tailored to patients' need, and starting from 5 repetitions, we can then modulate the type and the intensity of exercise, and we can add further repetitions up to 30. And also for patients with denervated muscle, the home-based full-body in-bed gym can be completed and integrated with the functional electrical stimulation with a great amplitude and a long-lasting impulse performed at home. And a previous study of 2 years of duration have already demonstrated that this the further contribute of functional electrical stimulation can be useful for patients with denervated muscle. So now Okay, so this is a video in which Professor Carraro is explaining the exercise protocol. So I would like to show you some exercises. So here they are. So they are really simple exercises performing in bed, useful for both upper and lower limbs, for the trunk and the paravertebral muscles. And this approach is useful since it combines both the achievement of global well-being, global fitness, and also the possibility to avoid the risk of a sedentary lifestyle. And it is also useful for patients with mobility impairment due to an acute disease or to chronic conditions. So this is the video that we provided also to patients. They can see this and repeat at home the exercise. Okay. I'll try to go to, okay. So during the pandemic, the recent pandemic, the COVID-19 pandemic, these kind of rehabilitation protocols had a great diffusion, both for patients restricted at home for the quarantine or for hospitalized patients that learned in hospital the treatment and then repeated the rehabilitation protocols at their home after the discharge. And more recently, this protocol was also applied to patients with long COVID syndrome, so the persistence of symptoms after weeks or months after the resolution of the acute COVID-19 infection. And so, and in particular for patients with this fatigue symptoms persisting after the COVID-19 acute infection resolution. So, regarding the preliminary results, we consider the results on cardiovascular function of these exercise protocols. And as we know, regular exercise has been proven to be effective in reducing systolic and diastolic blood pressure and improve endothelium dilatation. And also we collected data from a single subject and on a daily basis. And our data seems to reconfirm these results since we collected both a reduction in systolic and diastolic pressure. And in particular for the diastolic pressure, the results were statistically significant. So we collected data for 1 month before the treatment and then for a month of treatment. And during the month of treatment, we collected a reduction in both the outcomes. Then we collected data from 22 patients coming from the inpatient unit at the University of Padua. As we can see, they had a mean age of about 72 years old. And we collected from these patients data before and after 1 month of treatment. And for all these patients, we consider the short form health survey, regarding both the physical component and the mental component of quality of life. Data regarding pain perception, so the numerical rating scale, and the SARC-F questionnaire, a questionnaire that, as you know, considers the risk of sarcopenia, so strength of patients, the necessity of assisted walking, the ability to rise from a chair, climb stairs, and the risk of falls. All these outcomes after a month of treatment had positive results and improvement in all the outcomes were collected. And in particular for the mental component of the quality of life and for pain perception, we obtained statistical significant reduction. Maybe Also, we plan further follow-ups for these patients in order to understand if these positive effects are also maintained over time. And finally, we asked our patients to evaluate our treatment, and on a scale of 40 points, we collected a mean result of 38, so patients were really happy to perform this kind of protocol. They had a good compliance and also a good appreciation of this exercise protocol. So what we plan for the future? Nowadays, telemedicine and remote health services have seen an extreme development, and so we think that the home-based exercise protocol is feasible to be followed from a distance with doctors and therapists evaluations through telemedicine and telerehabilitation in order to adjust exercise to changes in patients' need and to follow their outcomes and their results over time. And finally, we think that to achieve this aim, new educational pathways are required, in particular for physical medicine doctors and therapists, because they need to understand and to learn during their educational training competencies about geriatric needs and also how to use the telemedicine and telerehabilitation instruments. So I conclude, so the home-based full-body in-bed gym has demonstrated to be a useful instrument to improve cardiovascular function, quality of life and pain in the patients evaluated, and we plan for the future to continue with our research. So thank you very much.